After weeks of frontline healthcare workers sounding the alarm about orders to conserve and reuse personal protective equipment, fearing it would make them more susceptible to contracting COVID-19, we've learned dozens of those workers have indeed tested positive for the virus. Specifically, 12 of them work at OHSU. 10 are from Providence Health and Services, 8 from Legacy Health, and 1 works in Linn County. That's 31 total. Yesterday, a respiratory therapist from OHSU predicted this.
While my colleagues and I have been lucky so far, we have no doubt that one of us is going to fall ill very soon.
Today, union leaders with the American Federation of State, County, and Municipal Employees held a national media call featuring a rep from Portland.
They're not safe, right? Taking these shortcuts around personal protective equipment doesn't work. And in the long run, it puts more workers and patients at risk.
Stacey Chamberlain also blasted local hospitals for, she believes, rationing PPE more than they need to in an effort to stockpile for a spike in coronavirus patients. Over the past several weeks, KGW has asked metro area hospitals multiple times how much PPE they have and how much they need. Answers tend to lack hard numbers. This one in from Kaiser Permanente today. Quote, Kaiser Permanente has the PPE we need right now to care for patients and protect staff. PPE on hand is being carefully monitored. Plastic face shields and goggles may be sanitized and reused. Today, a spokesperson for the Oregon Association of Hospitals and Health Systems also weighed in, telling us to conserve supplies in preparation for a massive surge in patients. Hospitals are following guidelines set out by the Centers for Disease Control and the Oregon Health Authority. We are now reporting on our PPE stocks to OHA and are working with the state and our established vendors to secure more PPE in the coming days and weeks. He added, hospitals are dedicated to keeping our essential healthcare workers safe. Both Providence and Kaiser say they are screening employees for symptoms when they show up for work. A rep for Kaiser wouldn't tell us how many healthcare workers in their system have tested positive, but he noted those who do could have contracted the virus off the job. Maggie Vespa, KGW News.